This is Roy, an 18-year-old Black American male who lives in a densely populated urban area in Northeast Ohio. He was raised by a single mom and is an only child. His mom works night shifts as a security guard for a hospital and day shifts as a cashier at a corner store. Since his mom is not there to make sure he goes to school, most mornings Roy wakes up late and misses the bus. He does not care about attending classes and misses school regularly. Roy does not enjoy school. His classes have 30 students, and the teachers only speak to him to reprimand him for missing days or doing poorly on tests. There aren't enough computers in the school, so most lessons are taught from books that Roy has no interest in. When Roy gets back to his and his mom's apartment, she is at her night job, and he spends the night drinking her beer and watching TV to help him sleep. On Saturdays, Roy plays soccer at the field 2 blocks away, where he is part of a team that has a designated captain who Roy looks up to. Roy is experiencing excessive alcohol consumption, which includes binge drinking, heavy drinking, and any drinking by pregnant women or people younger than age 21. His drinking is considered excessive because it is both illegal and can result in serious immediate and long-term consequences. Short-term symptoms include mental confusion, difficulty remaining conscious, vomiting, trouble breathing, clammy skin, and dulled automatic body responses. Long-term complications include increased risk for certain cancers, high blood pressure, heart disease, liver disease, weakened immune system, social and wellness issues, learning problems, memory problems, and relationship issues with family and friends. In Roy's age group, it is common to binge drink daily and drink heavily when compared to older age groups. Older populations are more likely to binge drink than drink heavily. This graph shows percentages of white, Black, and Asian Americans who abstain from drinking alcohol, separated by gender. Roy's population race group is moderately at risk for excessive alcohol consumption, and his gender group is less at risk when compared to other races. Roy lives in Northeast Ohio, which has a 20% excessive drinking rate. Compared to nearby states in the Midwest region, he is less at risk. The 5 social determinants of health factors are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Roy's family is just below the poverty line, and he takes on his mom's stress of keeping up with bills. The public school Roy attends has overworked staff and underfunded facilities that are poorly equipped to teach all students equitably. Roy frequently misses school due to few transportation options. Roy and his mom use Medicaid, and he only goes when he gets very sick. While in the waiting room, the environment is high stress. The quality of care is inattentive, and sometimes doctors prescribe medicine without clearly warning him of side effects, so he still drinks when he is sick. Roy's neighborhood is densely populated with a large unhoused population and few green spaces. He has neighborhood friends he made through soccer and knows one of his neighbors who checks in on him from time to time. A public health intervention that would assist Roy's situation is called SBI, Screening and Brief Intervention. This method is used to address substance use by asking validated screening questions that identify drinking patterns with short, non-judgmental conversation. The method is effective and low cost, only requiring an attentive authority figure. SBI can be performed quickly and can be implemented in Roy's visits to the clinic. Awareness of the effectiveness of SBI could assist people like Roy. Implementing a substance use awareness training into his soccer team would give him a healthy space to discuss why he has alcohol use habits. SBI would assist Roy's economic stability by reducing a behavior that leads him to miss school and lose concentration during class. With less drinking, his academic performance will not be hindered by alcohol use, and his future employability will be positively affected. It will reveal Roy's underlying stressors and allow him to identify why he feels detached from his environment. Addressing the issue will lead to improved attitude towards education and improve his attendance. Adding SBI to clinic visits as an option for his mom to request will introduce Roy to SBI methods and allow him to discuss alcohol consumption judgment-free. After being introduced to SBI, he will be less likely to engage in risky behaviors introduced to him through his environment. In Roy's community soccer team, his peers can act as a safe space for processing SBI. learning about the impact his environment has on his decisions and learning to make healthier choices.